Kind of shiny. Yeah, Talofa, Happy New Year. Wow. It's the 6th day of the new month of the new year, 2025. Yeah. It's been, first of all, public service announcement. Wakoe ka'alko wiki sa Amerika Samoa. COVID is back. COVID is back. Wear your mask. If you're used to wearing masks, take precautions. Wash your hands. Yeah, especially when you go to the bathroom. And so new government. Or the malo fu. Whainga malo fu. Pula mapulu. Yeah, first week. Makangi. And so it's starting off with some challenges. KHJ reported wa ika looking ako vanga o kesi bad reporting. Bad reporting. It was a concern. Arimela we ain't makal malofu. They still have to select the list of directors. To be approved. So everything here in American Samoa government with budget, directors, and all the other sorts has to be approved. Board appointments have to be approved by the Senate committee. That's how things work here. So what do we have? Right now we have temporary government or temporary interim leadership for deputies. So all the directors, the majority, if not all, have resigned their positions. And now the deputies are taking, memo went out last week for the deputies to hold together their department until, say, umang filifili directors. But what the problem we're having now is with the interim leadership. There's a breakdown. There's a breakdown of procedure. Well, the breakdown is, for example, the biggest challenges we have right now concerning healthcare is that Department of Health has not issued a warning or an advisory in regards to what's here. COVID is back again. RSV, all these things that have to deal with respiratory issues. They don't have it put on an advisory for people to, the usual PSA. No PSAs, none. I checked this morning, I checked the whole weekend. And my daughter was very ill this weekend from food poisoning or when I called ER Friday night and then Saturday afternoon and then yesterday. Every time I call, they said there's at least an 8 to 12 hour wait. We're going through this over and over and over and over. This is a season where it is heavily, this is hurricane season, by the way. And it won't finish until, April, mid-April. So, but this has been a constant problem. This has been a constant problem with healthcare. Constant problem. ER overcrowding. ER long wait times. You know, all you people that listen, you go to ER, you wait several hours. And there's been cases of misdiagnosis. Misdiagnosis. For example, I posted on my site, I reposted it for a child that they rushed him to the hospital because he was having respiratory issues. So the parents or the grandparents knew that the issues with that child. They knew the issues with that child and requested that the child get an x-ray. Okay? But the attending physician or pretend doctor said, no, he doesn't need an x-ray. He's just not wheezing or, just on the fly diagnosis without any further looking into the matter. So the child was sent home. And so the parents and grandparents took it upon themselves last week, put that child on the flight, whatever they did to do to get that kid on the flight Thursday night. And then when they got to Honolulu, they went to Kapiolani Medical Center. And what they told them was they're lucky the child made the flight. So I'm sure that Kapiolani Medical Center, well, they treated the kid and the kid was released a couple of days later. And then all it was, I think, if I'm correct, it was a bunch of antibiotics and breathing treatments to address the breathing problems. That's not the only misdiagnosis. Cases back when Dr. Leduo was also CEO recently that got fired by the board. He was also, there's a employee, his name is Tofala Yafeta he was blamed for the wrongful deaths. But there's so much more to be looked into that. So much more. You have these misdiagnoses over time and time again. When will it stop? When will they get a quality doctor? You see, this is the thing I have. This is the problem I have. You have these pretend doctors from Fiji who graduated from Fiji. And no disrespect to any of these doctors, I'm sure they are worth their weight in gold. But the problem we're having is we don't have a qualified MD to run the ER unit. We don't have a qualified triage doctor. There's so many, I see a lot of people from Fiji, from the States. We got white people, you got Fijians, you got Filipinos, and you got Samoans from all over, from New Zealand, with their qualifications. But we don't have a medical doctor, an MD, running the ER. So what does that bring? Well, then you're going to have these misdiagnosis cases. Then you have wrongful deaths. This system is designed, to my knowledge, that if the hospital is responsible for a wrongful death, we can't sue the hospital. I don't know if there's truth in that, but because it's socialized medicine, there are some things that the hospital cannot get penalized for. But what about the doctor that made that decision, that made that diagnosis? Can we sue them for damages? I'm not so happy, but there's something that's got to be done. There's something that's got to be done in order for these things, for the government, because LBJ is a government-owned hospital, it's something for the government to do. So, if I delay it my, I've got issues with my health, but I do everything I can not to get sick, not to get injured, that would cost me a visit to LBJ ER. I've had issues in the past where I've had, infection problems. Like the first time in December into January of 2022, I had a blood infection and it went to my bones. That's what they said. And it required me a 6-week stay at LBJ. They pumped me for antibiotics, and it was great. The doctor then made the right diagnosis. Hats off to Dr. Paulo. She's still there. It's a short Filipino lady. She's got it up here. But the issue is, she's just one doctor. You know, why can't they staff the ER with an MD? Well, I think the question, it becomes a money thing. Oh, we don't want to pay $250,000 for a doctor to come here. Then these issues will keep on persisting. When you put a price tag on health, when you put the monetary value on health, then you become the bad guy. I say, because now you're prioritizing, oh, well, we don't want to spend too much money on this service because we need that money for other services because we have a budget. Then write it in the budget. Anybody know what forecasting is? Write it in the budget. If your budget is 187 million, write it for 197 million or 200 million, even it out. That cushion there that you could do during the year, that you could hire doctors or emergency service. We have a great service by the Mormon Church and in conjunction with LBJ. These Mormon doctors, they have these much more elderly people that have the experience, but they are in surgical, they're in orthopedics, they're in all the different departments. But we don't have anybody in ER. So that's a challenge in there. So for the interim leadership, the current deputy directors who are holding the fort while they make a decision and put the list through for the people. You know, we're having this period of, there's a lull in activity, meaning the Department of Health is not doing their job because nobody has the initiative. They see what's going on. They hear what's going on from all the people reporting it on social media, talking in the town, talking amongst the people. The people, listen to the people. Listen to the people. Whaalongo I kangaka. Because we're not in Hawaii, what the problem is. But if you don't listen to the people and have your meetings and disregard what the public outcry is, then people die. Wrongful death. People get misdiagnosed. They go to Honolulu and they go, oh my God, you made it. Why does it have to be that way? I know we don't have the professional facilities, but we have to invest in professional people. You know, it seems like there's this trade program with the School of Medicine in Fiji and American Samoa and the Philippines. There are all these agreements, but what they're missing out is quality care. Quality care. There's a staffing problem, seems like. in all departments. In all departments. And since I'm talking about LBJ, we have this thing about kidney disease, right? Chronic kidney disease, CKD. We have a great dialysis unit there. The problem is there's so many people that are getting on dialysis. They're adding more shifts. That means there's more money putting out there. When the problem would have been handled if they expanded the unit and forecasted for the future. Amen. You know, now Hope Dialysis, a private company, is back in operations. That helps alleviate some of these developments. But you'll still have the problem. You still have people diagnosed with CKD stage 3, stage 4, stage 5 that are coming out. There's a lot that are coming down the pipeline. And if we don't have a quality unit, meaning a big expansion of the dialysis facility, then what are you going to have? What are you going to have? Overcrowding? More shifts? That's going to cost more money. Something's got to be done. I've already reached out to the CEO for an interview, and I've yet to hear back. Hopefully you'll hear back soon. Other local concerned citizens met with them at a meeting a couple weeks ago, and they have yet to hear from them. There's supposedly important meetings happen this week. This is important too. This has priority too. You know, there are meetings about the transition. That's all fine and dandy. But what you really have to address is the ER situation. Yes, they got a new CT scan machine. Great. Yes, they got this and that. But this persisting issue with ER and misdiagnosis, it's going to get worse if nothing is done about it. Listen, Mel. So if you keep riding with three wheels, you know, like a lowrider, three-wheel motion, the rest of it's about to break. And right now, as the saying goes, you know, it's putting a Band-Aid on a gunshot wound. Pow. Putting a Band-Aid on a gunshot wound. The gunshot wound's still there. It's just bandaged up. And you know what happens? It get infected if not treated right, and it's going to, you know, let's say the finger gets shot off, gets infected, is not treated right. What happens is when that infection goes, you'll lose the arm, and it goes further, you'll lose this whole section, and then the whole body is poisoned. That's how I see this healthcare for LBJ is going. You keep fixing these problems with Band-Aids. The problem you're going to have is that Band-Aid is not going to hold. You know? That Band-Aid is not going to hold. So, you know, if nobody's going to stand and answer for these things, Okoya, that with the children that are misdiagnosed, that have been shipped off to Honolulu and found out that it should have been this or should have been that. Speak up. I know you posted on social media, especially Facebook, but speak up. How can we improve something if these people don't hear from us? Because they're just saying, oh yeah, it's fine and dandy, we'll just do this and this. Attend to the people. And their needs. This is what government is about. It's for the people, by the people. You know, as the governor, the new governor mentioned in his speech on Friday, for the people, by the people, you know, et cetera, et cetera. So take precedence on that. We got to get this going. This is 2025. It has to be a new leaf. If everybody complained about the Lemano administration They had challenges too. But it's not just the governor and lieutenant governor, it's everybody. Oh man, it's raining again. Life in American Samoa. But if you don't address these problems efficiently, it's going to linger and it's going to get worse. Well, it's going to get worse before it gets better. I hate to say it. But if you're out there listening, talk to your representative. In my district is Larry Sanitoa and Ben Salval. Talk to your representative. Whatever district. And if you see a senator at lunch or dinner, tell them how you feel. Tell them about what happened to you. Because if they don't hear from you, how are they going to know how to serve you? Yep. So a new government for American Samoa, interim leadership seems to be lulling right now. This thing with the whooping cough supposedly coming from Samoa and all these other things, I'm telling you, if you need suggestions, I'll help you. I have a little bit of experience in healthcare. I myself am a patient. I've been through HMO and PPO in the States. I read through all that. I've taken care of people regards to those systems. And I understand the American Samoa system is socialized medicine. They're trying to get insurance involved with Medicaid, with a different avenue where instead of a group policy, you get an individual policy. That's all fine and dandy. But then it becomes to the money and to what can be done. Yeah, I'll keep asking for the specific budget for operations. What about a cushion? It ain't too much to ask for. What's the worst you're going to do? Shoot it down? And remember, all these things have to go to the phone to approve. So if you don't talk to your senator about if you don't talk to your representative about what's going on at the hospital, if you don't talk to your leaders, how are they going to feel right about justification of the budget, especially for the hospital? All right. So, looking forward to this new government and what they can bring to the table. But, let's get this rolling. Let's get this going. Let's take off these bandages and dress this wound right. Other than that, you try to have a good day. Yeah. All right.